Hello everyone, this is Chadi Alraies from SCAI-TV in Atlanta. With me is Dr. Adel Elmoghrabi. He is one of the General Cardiology Fellow at Wayne State University. Adel, thanks for being with us.
Thanks so much, Dr. Rice. I really appreciate it.
Yeah. So you presented a nice study highlighting the management of catheter-based therapy for patients presenting with PE. It's a case series to kind of educate us about.
Sure. So obviously I've been very interested in the realm of PEs and venous thromboembolism, and with the advent of all the novel endovascular therapies that are available now for management of pulmonary embolism, I decided to take a look at the data that we have in our institute. So I collected approximately 38 patients that we worked on from 2020 to the end of, during 2021. And we took a look at basically all the outcomes and the safety and efficacy of undergoing percutaneous thrombectomy using the Inari device. Overall, we found that the major adverse events, which was sort of a composite of any device-related complications or procedure-related pulmonary or cardiac complications, and mortality within the first 48 hours. And we found that our data was very similar to what was published in the FLAIR study, with approximately 5% rate of major adverse events. We also found similar data showing that there was statistically significant improvement in the mean pulmonary artery pressure pre and post thrombectomy. And additionally, one more thing that we also noted was a significant hemoglobin drop pre and post thrombectomy. As you can imagine, with aspiration thrombectomy, you're approximately aspirating 50 cc's every single time. So with 6 or 7 runs, you can have a significant drop in hemoglobin. Now, with the advent of the introduction of the flow saver device by Inari, obviously that will circumvent the significant blood loss that you will have, and you only have, whatever.
Yeah, and the mortality you mentioned 5%. Are they procedure or device related, or are they just because the patient was sick and comorbidities were high?
So we had 2 patients, one of them that developed a retroperitoneal hematoma. This patient had also had central lines placed prior to the actual procedure, so it's difficult to really adjudicate whether it was from the actual access for the procedure itself or if it was from previous central line. Another patient had intraprocedural massive hemoptysis, and again, it's difficult to say whether it's actually a device-related procedure, a complication, or just a procedure-related, from doing the right heart catheterization to start off with, or from distal embolization of the pulmonary embolism itself.
What's the conclusion of that?
So the conclusion is that, generally speaking, using percutaneous therapies such as the Inari device, there is low rates of major adverse events. So it's quite safe, and it's been shown to be so as well in other studies. And there is statistically significant improvement in your hemodynamic in pulmonary artery pressures. The long-term outcomes obviously need to be studied more and confirmed with regards to chronic thromboembolic pulmonary hypertension and quality of life.
Absolutely. Well, excellent study and excellent poster, and really congratulations for a well-done project. Please watch this video and others on the SCAI-TV. This is Chadi Alraies from SCAI-TV in Atlanta. Thank you so much, Adel.
Thank you so much for having me. Thank you.